Welcome to week 3 of 8 weeks to better outcomes. This week is all about baseline and thinking about what a baby might be trying to tell us when the baseline is not stable or is starting to rise. The baseline is one of the features of a CTG that hasn't changed much over the years. 110 to 160 beats per minute is all we've ever needed to remember. However, there is much more understanding in recent years of the significance of the baseline, what we should really expect and when we should be concerned. The new NICE guidance now recognises baseline as much more significant and shows this with the new classifications. So what is NICE now saying? Well, it says that baseline fetal heart rate will usually be between 110 and 160 beats per minute. There's nothing new there. However, it now tells us that a lower baseline fetal heart rate is expected with post-term pregnancies, while higher baseline rates in preterm pregnancies are normal. This is recognition of the physiology of the maturing nervous system which controls the baseline, and this gives us a better idea of what to expect within that 110 to 160 range, depending on gestation. The guidance also says we should be comparing the current CTG with earlier CTG traces or recordings of the fetal heart to establish if what we're hearing now is normal for this baby. It also now makes it clear why a rising baseline is concerning by stating a rise in baseline heart rate may represent either developing infection or hypoxia. Infection and hypoxia were not previously referred to in NICE or the Trust Fetal Monitoring guidance, leaving us just focusing on features rather than causes. By understanding the physiology and control of baseline and knowing what a rising baseline might be a sign of, we can better assess the whole clinical picture and choose conservative measures and management plans that are most likely to help. An understanding of gradually evolving hypoxia and choriamnitis are really important when considering baseline changes. So what's actually changing when it comes to classifications? Well, a rise in the baseline of 20 beats or more in the first stage of labour will be an amber feature, meaning that without any other changes, that makes your CTG suspicious in itself. This is regardless of whether the baseline is still between 110 and 160 beats per minute. A rise in the baseline of 20 beats or more in the second stage is a red feature, making the CTG instantly pathological. This takes into account the increased stress on baby in the second stage and the speed at which deterioration can take place. And then finally, a baseline above 160 beats per minute at any point in labour is a red feature and makes the CTG pathological. This does not mean that the baby needs to be delivered immediately, but it does mean that a full clinical assessment should be undertaken, appropriate conservative measures started, and a management plan that ensures further timely action is taken if improvements aren't seen. I know for some these changes might feel quite drastic, and people will worry that we will be classifying CTGs as suspicious and pathological that previously we wouldn't have been concerned about. NICE in their 2017 edition did put in a line in the text about the importance of a stable baseline and normal variability, but because it wasn't in the classification table, we didn't pay much attention to it and certainly didn't put it across into the trust guidance. The point of this change is to ensure that we understand and recognise those subtle changes in baseline that could be pointing to a baby that is starting to struggle. But it also means that when we're seeing decelerations in the absence of a change in baseline, we may be able to have that reassurance that actually baby is using that compensatory mechanism but not needing to increase its baseline because it's still coping. So although yes, we may be classifying CTGs as suspicious and pathological that previously we weren't, we will be better able to assess the whole clinical picture and make decisions about what is and what isn't appropriate management. As with all the changes that are coming, the focus is on moving away from pattern recognition and one-size-fits-all approach and thinking more about individual babies, what physiology is occurring that's causing the changes in the patterns that we're used to seeing, and how we manage that appropriately and safely to improve outcomes for everyone.